Commercial business for hospital systems drives all of their margin. When they bill Medicare, they get 80 cents. When they bill Medicaid, they're lucky if they get 40 cents. When they bill Disney, they get somewhere between $1.20 and $1.80. So we will look for those partners where we are driving their revenue, and therefore we have that leverage.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. All right, everyone, welcome back to Broken Benefits. Today we are joined by Barbara Wachsman. Barb is one of the luminaries of our industry. She ran benefits for one of the largest and most storied corporations in the world, Disney, for hundreds and hundreds of thousands of lives over a budget of billions and billions of healthcare dollars. While there, she also entered into likely the largest and most profound direct contract with a major hospital system in a major metro area. And she is full of great advice and in a ton of other areas, because she's also worked within hospital systems, private equity, on the consulting side, and within employer benefits as well. We're so excited to have her here. Welcome to the show, Barbara.
Thanks, Lee. It's great to be here. And you know I can be opinionated, so I know it's going to be a great discussion.
No, that's perfect. Okay, so starting off, maybe just tell us a little bit about what it's like to run benefits at a company like Disney with so many different stakeholders.
Oh my gosh, what a great place to start. I mean, let's just dive right in. Probably one of the most interesting, rewarding, frustrating, exciting places to be if you are a healthcare person. And, when you say run benefits, I mean, my place at Disney in benefits was really running the healthcare benefits that we had. We had someone who was more
Right.
actively involved in retirement. But it's a super exciting place to be. I mean, there is a lot of pressure because there is so much money involved. We spent close to, at the time, almost $3 billion a year. And I want to talk a little bit more about that as we get into our conversation, because with trend, that means you're paying another sometimes $100 million every single year, and want to see some change for that. There's a lot of pressure to actually see improvement if you're paying that much money every year. So there is some pressure. I think it's all self-imposed to really do the right thing, and pressure to be able to provide benefits to such a wide array of employees. At the time, I was there, and I have formally retired from Disney, as I think we've talked about. We had 200,000 lives in all kinds of different business units, from high paid talent to the landscapers and housekeepers out in the parks. So just super interesting, very challenging, and a lot of fun. And everybody who's in healthcare should at some point in their career work for an employer.
Everyone, now just a quick word from today's sponsor.
Mom, are you crying?
No, sweetie. Just some allergies. Come here. Let's go play. Come on.
1 in 4 Americans had trouble paying a recent medical bill. Many of these people affected work for companies just like yours. Start giving your employees 100% medical coverage with Catalyze Health.
What are some of the, I'll call them superpowers, that come from having the knowledge on the provider side and population health side, that then when you stepped into the employer role, it gave you an extra lens through which to operate?
Oh my God, Lee, you've just given me a platform to talk for the next, 3 hours about healthcare. I mean, I think one of the most important things for folks that are benefit professionals is to realize that you are delivering healthcare in this country. There are only 3 sources of funds to deliver care: Medicare, Medicaid, and the commercial business. And that's so important if you really are interested in having a more productive workforce. But in terms of how important it is to understand that you are delivering care, I mean, this is what's really key.
Hmm. When you look back on your time managing this health plan, what are some of the major initiatives that you put in that you would think of as milestones?
Oh my gosh, I think it, ultimately goes back to what your mission and your guiding principles are as an individual professional, but also the individual company that you're working for. For some companies, it's extremely important to save money. I mean, benefits could be somewhere between a third and a fourth of your costs. For other employers like Disney, the most important element was really to have a productive workforce. And as I like to say, it was so important for us to have someone who was healthy, able to come to work and drive that ride. So for Disney, it was just extremely important to have good healthcare being delivered.
Yeah.
That is difficult when you've got such a variety of individuals and a variety of perspectives from your various business units. I mean, if you've got parks that's running on, extremely thin margins at the time, they're probably more interested in really driving cost savings to where you have others that are in the creative side that are much more interested in providing every single thing that helps support a creative person. And as Bob
Mhm.
Iger would say, we were absolutely nothing at Disney without that creative spark that really created the brand. So I would
Mm,
say, those are some of the extremely important things, which is to really understand what your basic mission and philosophy is. But go back, tell me the question again. I think I went off on a little
yeah.
bit of a tangent.
No, 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 you're good. When looking at the kind of big programs or things that you
Yeah,
tried, maybe
right.
what were the three of some of the more
Yeah.
interesting ones? I know one of them would have been the direct contracting
Yeah,
that
of
you did,
course. So
but
again, and I think
beyond
we're
that as well.
yeah, and I think what I was getting a little distracted. I think, thinking about all the different types of people and the different things that we were trying to achieve, certainly for us more broadly as an employer, it was to have really that healthy, productive employee. And how do you get that? You get that by having affordable care with high quality providers that are accessible to you. So everything we did was really about driving a delivery system that had that affordability, accessibility, high quality care. And that's where and I know we'll talk a little bit more about this. That's what really started in Florida, where we were having trouble with all of those three elements that really give you that productive employee. So, one, focusing on those direct relationships with providers, getting that access, that immediate access over the high quality providers that we were able to identify. So, as an example, in Florida, that was Orlando Hospital, that was Florida Health, Florida, what is now Advent, but Florida Hospital. And I have to say, Lee, very interestingly, this morning in Becker's, which is a publication mostly for the hospital industry, there was
Yeah.
an announcement today that Disney is deepening that relationship with now Advent or the Adventist Health System chain in Florida. And there was reference to the direct contracting work that we did. It was actually starting in 2018, but is still going very strong today. But we
Wow.
did that throughout our ecosystem. So that was in Burbank, that was in Florida, that was bringing direct providers onto our campus. Everything we could do to have more of a direct relationship with the delivery system, first and foremost, identifying the highest quality providers that were there. That was really what we tried to do in terms of those big programs that would get that, again, always back to that fundamental philosophy of having a productive workforce.
Yeah. I want to park on the productive workforce comment for just a second. How did you manage or measure whether or not you were succeeding in helping your people be more productive? Like days off or hours clocked? I'm trying to think of what the KPIs were.
Well, that's such a good question because as innovators come forward today and say, look, I've got the next best thing since sliced bread, the
Mhm.
first thing they want to do is tell you, oh, this really will influence how productive your workforce is. And it's really hard to measure that. And, for those listening to this podcast that are benefits folks, you'll realize that those metrics that come out regarding absenteeism, disability claims, all those kinds of things are in a separate part of the organization. They're typically in the part that goes up into the financial risk management group. It's extremely difficult to pull that data, not only from the fact that they are in a different part of the organization and sometimes governance kind of gets in the way, but
Right.
that data is just really hard to collect, especially when you have PTO banks and these kinds of things, to be able to really identify why are people going out. So we did something very different. We looked at health risk scores. And at the start of our foray into this idea of really focusing on a healthier workforce, we worked actually with at the time with WebMD to measure a health risk score for every individual at Disney and more broadly for Disney's risk score. And we could also break that down by business units. And we measured that score going forward. And we had certain metrics, really easy metrics. Were we able to keep those high risk folks at that level? Were we able to prevent the medium risk scores from moving into high risk? And were we able to keep the low low? And we measured that on a regular basis by business unit. And I will tell you, there's some, and anybody who's listening who's an underwriter realizes there's some difficulty with that because those risk scores are going to change over time
Sure.
just due to factors that you can't control, like age. So, especially at Disney, where we had an older workforce, long tenured employees, so that meant we had people who are aging into our benefit system. You had to take into account that those risk scores would migrate simply because of age. And it was
Sure.
so important for us to understand, what were those factors, those health factors, what really were driving the conditions that come as people age. So for us, it was very simple. It was looking at our health risk.
Yeah. And were you able to succeed in that? It seems like across hundreds of thousands of people, you that doesn't seem like an easy task. So
Well,
I'm
it
curious what
wasn't
the
an
result.
easy task. And, there's a lot that goes into calculating those scores and being able to decide, is the movement because of something that we can control? So do we have too many people that have heart disease and we really need to focus on having people getting their blood pressure down? Or
Mhm.
are those scores migrating because people are just aging and people are not leaving Disney? And so and it's funny, Fidelity at one point, who was our benefit administrator, told us that Disney had more folks over 70 years old than any other company they'd ever been involved with. And I think that is just testament to the brand. People want to be at Disney, and I'd like to say because of the great benefits that we offered. But
Yeah.
it is difficult to calculate that. It's also difficult when you are a company that is acquiring other companies. And while I was there, this was kind of the start of uh, tech was just so important to a company like Disney in terms of the kinds of product and services, what we were delivering in terms of entertainment. And we were acquiring a number of tech companies from Silicon Valley that had a much younger population. So we really had to, kind of understand, are those younger folks that do not have the conditions that our older folks have, are they driving our risk scores? Are they lowering our costs in a way that is not a true uh, recognition of where our costs really were? So to be able to
Right.
pull out some of those eccentricities and say, no, no, we're not doing really so well. It's because we just acquired, 100, 5,000
Pixar,
20
whatever.
somethings. So you're absolutely right. I mean, there's some tricks to it, but bottom line, what you should be driving toward always is that
Mhm.
more productive workforce. And I hate to say it, but great benefits really are about improving human capital. And
Mhm.
I know a lot of us don't like to talk about you and I and as great people as a widget, but in
Mhm.
fact, we are there as a productive element of our business and need to think
Yeah.
about it in that way. And as a benefits person, when you are walking into the CFO's office or you're walking into the CEO's office, they're interested in knowing how many people have been out. Do we have enough people in the parks driving those rides? That is really what they want to know.
That's great. So you realize you're spending a lot of money and have a lot of people in Orlando. And you have the idea that, hey, we're going to do some direct contracting here. How do you choose the partners?
Again, that's a great jumping off point to talk about all kinds of different things. Number one, as a benefit professional, you need to deeply, deeply understand your population and who your provider partners are. And that really isn't so difficult. Who are the big providers that you're using? Where are all your admissions? Where is all your costs coming from? Who are people seeing? For us in Florida, and I think for most folks that are working in big urban areas, it's really clear, especially now with all the consolidation that's going on. It is really clear who those big hospital systems are. But I think first and foremost, you need to understand where are your employees going, who's taking care of them, who's interested in working with us because we are driving revenue. Again, a side point, commercial business for hospital systems drives all of their margin. When they bill Medicare, they get 80 cents. When they bill Medicaid, they're lucky if they get 40 cents. When they bill Disney, they get somewhere between $1.20 and $1.80. So we will look for those partners where we are driving their revenue, and therefore we have that leverage. Now, in Florida, it was crystal clear. There were two big players. We also knew we needed to work with both of them because neither hospital system was able to handle the volume that we were
Mm,
there to offer. We also wanted to have more of a competitive model, but it was very clear where our admissions were going, who was taking care of our employees, and you just really need to understand how much money you are spending, how much money you're spending that you'd rather not spend. So really
mhm.
understanding the data is just absolutely critical. And I will say, and this is again, we're a larger employer that has a data warehouse. We had far more data than either one of the providers could get from the carrier. So we knew exactly what we were paying, who we were paying, and what we were paying for.
Mhm.
I think you also need to know who in the market might get hurt by us driving business to one place or the other. And there
Mm,
were other hospitals surrounding these two big players that were in our main market in Central Florida in Orlando.
right.
And how funny that all of a sudden we would be hearing from those players as well. Could they
Mm,
participate? Telling us what they had to offer that the others didn't have to offer. Understanding that marketplace, who the players are, where the leverage points are, just extremely important. And let me mention one other thing, the politics of the hospital business in a community is so critical. These institutions are just the heart of many communities. They are also a place where your senior executives may sit on a board. Your senior executives may have other types of relationships with the senior executives of these hospital systems. They may be a customer of ours. And in fact, in Florida, Florida Hospital, which I'll interchangeably call Florida Hospital or Advent, was
mhm.
a major customer of Disney. They had a pavilion. They were providing they would buy advertising. And to be able to talk to our business development people about the money that the hospitals were paying us versus the money we were paying them was just an extremely delicate, interesting conversation. But the
Wow.
fact that we were paying them hundreds of millions of dollars really did, and that this was an opportunity to have a better customer experience and a more productive employee trumped our business development folks who said, look, I'm selling ads to buses that Advent is buying, and I don't want to lose that business. But
Hmm.
at least we could understand those different pressure points and work together on it.
Wow. Okay. So you start approaching the marketplace. There's two major players and a lot of smaller ones. You want to reduce costs. There's relationships and business entanglements and connectivity all over. So you want to be sensitive to those things while holding to your principles. What did you do next?
You know, I'm going to talk way too much about principles today.
Oh,
So we knew that the only way to drive more affordable care was to be able to align incentives. And this is one
right.
of my principles as a healthcare person that has been at the core of how I think about healthcare for my entire career, but it's also what really helps you manage cost and the experience. And that is value-based care, risk-based care, aligning incentives. We also really felt that primary care had to be the core tenet of the delivery system.
Okay.
So we knew we had our strategy. We knew we wanted to have it risk-based. We knew we wanted to have it primary care-based. We knew we wanted to improve the patient experience. And we
Okay.
went in with a model and said, it was an interesting conversation with both hospital CEOs. We said, we want this to be full risk, up
Okay.
and down. We want there to be an opportunity for you to make money. It was extremely important for us for them to be able to succeed. But we said we are going to include everything. We are going to include pharmacy. We're going to give you some support on the pharmacy side, knowing that there's some extremely expensive specialty drugs coming down the pike. But we
Mm-hmm.
are going to give to you the opportunity to take care of every part of this employee, and we are going to pay you a reasonable amount for that. But here's the model. If you come in below this number, you are going to get this kind of bonus. If you're over this number, and we're going to agree to what this number is, we are going to have dueling actuaries that are going to sit down together and come up with what these numbers are. And if you're over that number, well, you're going to lose some money. But be very clear, we are all in agreement that this is the number that we are paying today, and we are going to give you a trend increase. That's part of the deal, but you're going to have to learn. And I say this with big quotes, you're going to have to learn how to manage every aspect of the care of a Disney employee. And I will say, this was new. I mean, these are major systems that had been working primarily almost entirely under a fee for service model. And
Right.
it was very interesting. The CEO of one of the systems, who just an amazing guy, long retired, when we finally came to agreement that we would work together under this model, he said, "Oh, fine, Barbara. We know we're going to have to work under these kinds of incentive systems under Medicare, and we might as well learn on Disney." And I said, "That's fine with me."
Smart. Yeah.
I also had an interesting experience as we moved into the operational aspects of this. And of course, I'm in California, I'm in Los Angeles. I had worked for an HMO for many years that had been known to have these kinds of full risk deals. And
Mm-hmm.
uh, one of the consultants for the hospital, another hospital CEO, said to me, "Look, Barbara, you've two things. One, stop talking about California. And two, you've got to stop talking about how they should manage care." You know? And I said, "Thank you. And I am all over that. One, I'll stop talking about California. And two, this is their business. Here are the dollars. They know how to run their business, and we're going to let them run their business." So we really stepped away, other than some issues around the customer experience, of being able to say, "Gee, you need to reduce the amount you're paying specialists," or "Gee, you really need you need a center of excellence for dialysis." Or we really just said, "Look, this is your money to spend. We want you to succeed. And if you do raise your hand and say, 'Look, we'd really like some help here,' and that actually did come up in a couple of areas, we're here to help you, but go forth
Yeah. How
and
was the
operate
learning
your
curve?
own business, and let's see how we do."
Yeah. How was the learning curve as these hospitals were trying to shift the way that they practice care? I mean,
Oh, goodness.
many would argue, perhaps cynically, no way a large fee for service system is going to change. Like they cannot change their behavior. The die is cast. But others, for instance, these hospitals would probably disagree with that.
Oh gosh, Lee, you've been around way too long. I don't think that was a question. I think it was like, you and I both know that this is the case.
It's
But
hard. I mean, it's really hard to change. I'm just curious,
it is. And
we don't
but
expect perfection, but like, was it easier than they thought it would be, acknowledging that it would be hard, or did it end up even being even that much more challenging.
Yeah. There's so many tangents we could go off on, and I hope we have a chance to talk about a little bit later, benefit professionals and what it is they need to know to really be able to do a great job. And one
Yeah.
thing they need to understand is, as you were just saying, hospitals deliver care. I mean, these are clinical operations. These are filled with physicians who did not go to business school. These are entities that are really trying desperately to understand, how do we exist? How do we make money? What's the business model that we need to use in these enormous systems that are really about clinical care? And
Mm.
it is really, it's difficult, but they are doing it, no question about it. So I think understanding really the pain points that hospitals have. It was interesting, and I'm going to just talk kind of broadly here for those of you listening, and maybe Lee, for you in your own experience.
Sure.
Hospitals bitterly complain about the carrier. They bitterly complain about the nurses
Sure.
who come onto the hospital floor and are looking at charts and looking over the shoulder of the physician and being annoying. And they can just tell you, oh, we just get these people out of my hospital. And we said, okay, fine. We'll get them out of your hospital. You are going to have every element of responsibility for caring for our employees. And let's just say, when they're admitted, that means you are going to figure out when they need to go out. You're going to do the case management. You're going to figure out, gee, is this person able to go home? And do I need this? All those things that carrier does today that's so annoying. And they said, and I said, we'd love to have you do that. We'll pay you for it. Go forth, and the carriers will be out of your hair. One of the systems came back and said, we really aren't able to do that. We have not developed that system to do that. And in fact, the carrier was, invited back in to do some of the elements of case management, retrospective review, all those things that the carrier
Hmm.
does today. So I thought that was just very interesting. I think that, hospitals would like to do it all, but I think there's and we see that today, hospitals running health plans. It's really hard for them to do that. They just don't have all of those elements that come with paying claims, with managing your risk, taking fiduciary responsibility when things go wrong. I mean, these just aren't things that naturally are, or at least we're in a we're in a hospital system. So anyway,
That's
yes, we did,
great.
there were some surprises, and I will say something else. I mean, our carrier was not especially happy about
Sure.
this because we did go direct,
Yeah.
but because it was full risk, which means that you've got to take care of everybody all the time, and that includes when I go skiing and break my leg, you need a wrap network. And the carrier we worked with had a terrific ability to do that. And we said, look, we really need your help. We'd like to have
Yeah.
you. We'll buy a wrap network from you. So, it's lovely when you say, get rid of them. We don't like them. They're too expensive. But in fact, they all need to work together. And that's why the deal in Florida works.
Your carrier did the administration then? Like they paid all the
No,
claims?
we actually went out and we went to RFP for a TPA, who was going to pay claims and do everything else a TPA or a carrier has to do to make the trains run on time to
Sure.
get people paid. We were adamant that we wanted this TPA to be able to pay risk-based if you want to call it capitation. Although, really there are ways to be able to pay to work under a risk-based deal, but have claims paid underneath the covers. So we did contract with a TPA, and I will just say, in some ways, we taught the TPA a lot about how we wanted to have these claims paid, and
Yeah.
what we felt that their role was in looking at large cases, high cost claims, all those things that you have to have a carrier do that at that time, not many TPAs were doing. TPAs were working more with smaller organizations. But yeah, no, we went out and found a different claims payer.
That's great. Last question on this before we switch topics.
Yeah.
If you were giving advice to a room full of progressive benefits leaders, maybe not at a 300,000, 400,000 life company, but at, a modest sized, call it 5 to 50,000 life company, what advice would you give them about how they might approach direct contracting?
Mm. First and foremost, I'd say to all of them, it's the delivery system, stupid. And,
Mm,
paraphrasing Bill Clinton,
yeah.
it is all about the delivery system and get as close as you can to them. And I will say, and they all know, change, engagement, all those things that we talk about every single day happen behind the exam room door with the physician, that trusted advisor. How do you get there? A lot of it depends on the market you're in, depends on the size of company. You could come together, and you'll see this now. Some of the big coalitions are coming together to do that kind of direct contracting on behalf of a group of employers. If you are even a mid-sized employer, Lee, let's just say you're a 5,000 live employer, but you're in a medium-sized city where there's one big system that you work with every single day, there's an opportunity to work directly with them. Maybe it's just around services that that are highly utilized, and you want to have a special relationship regarding that particular service. It's so important to you. We did this with mental health in Burbank. We actually hired therapists. We put them on the studio lot to help our employees. It was something we wanted to control a little bit more than the way it was being handled before that. So I would
Yeah.
just say, there are many ways to structure these direct deals. It doesn't have to be, what we did, where we had the leverage, where we had the volume, where we had two willing players. But you will find the hospital systems in your community desperately want to work with you directly. Why? Because they can understand what their true risk is. They know the people that are coming in are, I'll just use ESPN. In Bristol, we had 5,000 employees. Most of them are young male ex jocks.
Yeah.
What the providers need to know is that we need, family planning services, we need orthopedics, MSK. To be able to have that direct relationship with you, the employer, is gold to them. They understand what your needs are, they understand what they need to provide, they understand what their risk is.
Mhm.
So there you go. Two absolute willing partners, and just coming up with the deal. And this is, Lee, this is what I hear every single time. This is hard. It's time consuming. It's difficult. I have a small staff. That is absolutely true. But I think for those of us that are interested in strategy and outcomes, that senior benefits person needs to be thinking about this, putting these deals in place, and not thinking about the problem with a claim that just came across your desk. And I will say,
Mhm.
your CEO's wife didn't get a claim paid properly. Half of us are dealing with those kinds of things on a day-to-day basis.
Right.
You need to be able to step back and say, what is it we're trying to achieve? Lower costs, more affordability, healthier employees. How do we get that? One way is get directly to that delivery system. Tell them what
Mhm.
those goals are, make them accountable, give them incentives to meet those goals, and suddenly you're doing better in terms of meeting your own mission, I guess, what you've decided you need to do in your own organization.
Everyone, now just a quick word from today's sponsor.
Lemonade for 50 cents. It's for a good cause.
This situation seems terrible, right? Well, what if I told you it actually happened in the United States in 2021? These are the families of people who work for companies just like yours. Give your employees 100% medical coverage with Catalyze Health.
Talking about benefits managers, they have big jobs to fill. There's massive new amounts of complexity, and these departments are chronically understaffed.
Mm.
What are some of the key actions that benefits managers ought to be taking to make benefits run better and to deliver better outcomes that they might be missing today?
Oh my goodness. That I mean, first and foremost, it goes with hiring the right team for sure, even though
Okay.
you've got, you don't have a big, I mean, look, benefits people are in the basement. And I say that, first of all, I say all of this with true love in my heart, having been one. We
Sure,
are
sure. You've been
not,
there. These are your people.
these are my peeves. You're not at the top of the food chain. You are
Right.
an expense.
Mhm.
And really, all that good work you do, all those negotiations you do, I've walked into a room where someone says, Okay, fine, you saved us $100 million. What have you done for me lately?" I mean, it's a difficult role. You've got a small team, but I think hiring people that are curious, that have technical skills, communication skills, have absolute financial literacy. And by that, I mean the basic principles of underwriting, really deeply understand how these systems work. So surrounding you with those kinds of people, I think does make a difference. Um, that's just it's a great question. It's a broad question. Somebody, if you're in a large organization, being highly skilled at your budgeting process and being able to get the
Mhm.
money you need to be able to do what you want to do, to be able to find that, I guess I would call him your rabbi, somebody who is going to have your back, someone who's in the organization that can move your ideas up the chain. My goodness, we could talk about all of those. I guess I would call them somewhat softer elements that are going to
Mm.
make you successful in terms of the things you want to do. I think having great advisors, I know, I was just part of another um, group that did a survey of benefits people, asking what some of the problems were. And actually, people were talking about some of the difficulties with our consulting brethren. But I think
Mhm.
there's super smart people out there finding those key advisors that you want to work with one on one, that have the skills that you need to do the deals you want to do. I will say, uh, having Jane Jensen, who was the senior actuary at WTW, who I worked with at Disney for probably a good 10 years, and who was
Mhm.
absolutely right hand person, critical to the deal in Florida and helping us properly price what the number should be, was critical. It wasn't WTW that I was hiring, it was Jane Jensen. And I will say there were others, there were Mercer folks, there were Aon folks, but finding those advisors that are smart and can deliver the skill that you don't have internally is just absolutely important.
I love that.
But I don't know, Lee, maybe there's some things I missed that you think are important. Are there things that you hear as you're talking to people?
I love the concept of getting the right talents on your team. What we see within, I see across the employers within the HTA and elsewhere is that our our highest performing firms, and I would couch that in terms of low cost trend and good satisfaction, high actuarial value in the plan benefit, et cetera. The the teams are not all alike, but there
Mhm.
are a disproportionate number of them who have engineers, accountants, uh, and analysts in real decision making authority within those teams, which is a little bit rare uh, in typical HR positions.
Mhm,
And so it seems like that is a contributing factor that disproportionately helps teams to do well,
mhm, mhm. Yeah,
similar
yeah,
to what you're mentioning here. What do
yeah.
you think is like one of the biggest blind spots that benefits managers have today that's like, oh my gosh, you should do X or Y, but most people are missing it?
Gosh, again, such a good question. Um, a couple things. One, I think getting, completely wound up and devoting all of your smart time and energy to handling day-to-day operational issues. I don't want to say that that is not a super important part of your job. And, the day that, again, the CEO's secretary calls you and says, this claim did not get paid properly, your job may depend on that. But I think
Right.
to not have an element in your group or, in your department that is able to step back and think about what are we trying to achieve here. And the time frame of doing anything in benefits is so long that you need to step back and think, what do we want to do in 2 years? Where do we want to be? What are we trying to achieve, and what do we need to get there? So I think getting wound up in day-to-day minutia is and not having that strategic vision is a problem. I think not getting out of the basement and finding that person in your organization, that senior person that can help you move your ideas up the chain. And when you're going to have big ideas, which is we are going to focus on primary care in this organization, you're going to have to get the approval of whoever is handling the governance of benefits. So you need someone who's going to help you walk up those stairs to get to that person, make them understand what you're trying to achieve, and be able to get that kind of approval and support. And I say, find those folks in your organization, develop those relationships, and hold your friends close and your enemies closer. You need to also understand in your organization who is not going to want to do what we're thinking about doing. And you're going to want to talk to them and try to explain the greater good. Yeah, you're going to lose your physician, and I'm sorry about that. That person is unlicensed and you shouldn't be seeing them anyway. But this is what we're trying to achieve as an organization. And as a side note, as people were telling me, I mean, we had well over 2,000 physicians in the CIN that we created in Florida, but I still had people telling me, look, my physician told me he's retiring because of you. And I'd say, well, okay, fine. And they'd say, we just don't, oh my gosh, you're reducing the number of physicians. And I said, how many physicians do you need? You need one, and that is the right physician for you. And at that point, it's hard for them to say much more about that. But it means that I have to step up and say, here's what we're going to do to find you the right physician. And I'm going to guarantee that every physician that is in this network is board certified, which is not the case today. And why is board certification important? We had something called a health zone where people could go out into our portal and look to see, what do you want to look for in a primary care physician? What are the important skills? And having those physicians available and being able to say, part of the deal we've cut with them is that they are going to see you immediately when you need to see them. So kind of going off on a lot of tangents here, but I think
this is all great advice.
Having those folks in the organization that can help you, having that strategic vision, deeply understanding healthcare. I mean, that, what are those leverage points that you can press on that are going to get what you want with that delivery system? And that might mean, look, and at one point, I think we said in Florida, and actually the Cadillac tax was still in play when we started looking at this. And we had one sheet of paper in front of the CEO, and we said, this is where our claims are today. This is where we need to be. We've already talked to the internal board, the subcommittee of the board that we reported to, and we've already told them we will not be exposed to this tax. Here's the difference. If you can work with us to reduce that difference, that's great. If you can't, we're going to reduce benefits. We would never reduce benefits at Disney. But what does this mean? We said, look, if we reduce benefits, and by that I mean a higher deductible, this kind of thing, that means you're going to have more bad debt. What would you like? Do you want to work with us to bring down our costs, improve quality, or do you want more bad debt? It's going to be up to you. So to be able to, understand what really drives these systems, and to be able to use those leverage points, it is a business. And to be able to use those leverage points to get what you want is absolutely fair game.
If I'm a benefits manager and I want to do a better job running my area of the business, what are the handful of key metrics I should be reviewing each month? What are the main areas?
Well, I think you should be looking at the metrics that HTA is giving you.
Oh.
and looking to see how good those are. Oh gosh, again, such an interesting topic. And it
talked about productivity, right? The sort of the social, or not the social risk, the health. The health risk of the population. Clearly, you were monitoring that on a recurring basis.
I mean,
how are we doing with that?
You're absolutely right. And those numbers move pretty slowly. So you're going to be looking at those numbers
That
over
makes sense.
time. But, if you've got a data warehouse, you have a partner that's giving you all this data, you need to create a dashboard that has just a few of those key metrics and actually then be able to create another dashboard that you can take upstairs when you're going to see the person that's supporting you or the CEO.
Right.
Some of the things we looked at that drive costs. And again, really, why were we concerned about costs? Because we're concerned about affordability for the employee. You look at utilization rates. Are they going up? What do our large claims look like? What is happening that all of a sudden the rate of our hospital costs are skyrocketing? What is going on? So I think we would
Yeah.
just look at some of those key metrics, because look, 70% of your costs are driven by the hospital. So we would be really looking at ER visits. And look, you're going to have ER visits, but we just
Sure.
want to know who's going there. Why are these increasing? Why aren't the physicians taking care of these employees? So some of those key metrics that drive costs, some of the metrics that we'd look at would be things like, complaints that are coming through our customer service lines, because the employee experience, of course, is everything at Disney. So I think what I'd like to say, those metrics are going to depend on what you're trying to achieve, but the key is to find
Yeah.
3 or 4 key metrics that you can follow that will be changing on a regular, say, monthly or quarterly basis that let you know there is a problem, and then to be able to track those broader metrics like your health risk scores that are going to change over time.
Benefits can be kind of thankless, but over
Your words, not
the
mine.
but over the breadth, what benefits or programs did you put in over your tenure that people actually loved or enjoyed?
Oh my goodness gracious. Um, and that question is really relevant today to the folks that you're interviewing that are in the seat today, because they're throwing so many things against the wall, whether it's, fertility, family forming benefits, MSK benefits. I think one thing people really did want was a better fertility benefit, and we did improve that. Um, Gosh, I think because we focus so much on just supporting you when you need health care. I think
Mhm.
to be able to have physicians that were accessible to our employees was extremely important. We did put in a wellness program where we paid people to do the right thing. They liked that. They liked the ability to get money for knowing your numbers or for setting a goal to improve your own health status. I think that was very popular.
Yeah.
It's funny. I think the main thing is eliminating hassles, and just to be able to say, I was able to go there, get care, didn't cost me anything. They solved my problem. Um, that was just extremely important to our employees to be able to offer benefits in Florida where you had people speaking Haitian Creole, which is extremely important in Florida, or in
Mhm.
Anaheim to have people that would see you and that are speaking Spanish. I think just making healthcare a better experience for our employees. We had a tendency to turn to the physician to offer things like, um, oh gosh, gut health, for example. I mean, if you had problems with that, you need to go see your physician, and maybe you need to go see a gastroenterologist. So we wouldn't necessarily put in a gut health program.
Mhm.
Um, I don't know if that answers your question, but for us, it was
Yeah,
really
great.
about the broader issue of getting good care.
Yeah, no, that makes great sense. What was something that, one or more thoughts or beliefs that you had in your career that you realized were wrong, or more broadly or more tactically, decisions you made that you hoped were going to work out really well, and then they ended up being a big nothing, and led you to learn.
Wait, big nothing? I mean, come on. You're so right. No,
I do
oh
big
gosh,
nothings all the time. It's where I learn my best lessons. But
you are
yeah.
so right, because we all have those experiences.
Yeah.
Um, oh my gosh. I think one of my biggest problems is that not everybody thinks healthcare is a right and not a privilege. Sometimes people are like, no, no, we're not going to pay people to do the right thing in wellness. No, no. I think understanding that there's just, a lot of different perspectives in terms of ha- the responsibility that an individual has versus you who's actually building and delivering care. I think,
Mhm.
one thing I've always been very disappointed in are HDHPs, high deductible plans.
Yeah,
I really saw that as pure cost shift onto the employee. And for me, that minimum wage worker, 80% of the employees at Disney are minimum wage workers. Those are folks that really cannot afford those $5,000 deductibles. Uh,
totally.
but to understand, this is something that there are employers out there that absolutely must save money. They are on thin margins. Their existence depends on saving as much money as they can. And for some of them, they need to put in these, I would call them restrictions or, shifting costs to the employee. I think being able to accept that and understand that has always been a bit difficult for me. I'll try to argue against it every opportunity I have. So understanding the benefit design that, may not fit, my vision of what healthcare should be, I think has been uh, you know, been a weak point for me. you know, you have to kind of limit your frustration when you're working in healthcare. And Lee, I'm so glad that you're doing this podcast. And I think,
Oh, thanks.
the system really is broken. It does need to be fixed somehow. I was cleaning out my garage and looking at a box of papers that I had from something I'd done, oh, I don't know, 25 years ago. It was the same things we're doing today. And I think not to let that frustration get to you and do things like HTA, do things
Mhm.
like direct contracting, and have the courage to make change. And I think
Yeah.
the frustration that you can feel in your job sometimes can be a little overwhelming, and
Mhm.
that, you just have to one foot in front of the other and try innovation, try HTA, try direct contracting. These things will make a difference in the
Mm.
way care is being delivered.
Mm, mm,
So,
mm, mm.
trying to keep your frustration level down, accepting that other people aren't as brilliant as you are, and I'm saying this, with true
Right.
humility, understanding there are a lot of different ways to think about this,
Everybody sees it the same way. Yeah.
and right.
Last topic, and I want to get this in as we're wrapping up, is teach us a little bit about primary care, how it's changing, why it's important, and what we should do.
Boy, and you should enter into this conversation, absolutely. First
I
of all,
love
I
it.
think we all agree primary care should be at the core of the way care is delivered in this country. I mean, we know
Mm,
this is having that, and as we said at Disney, we are gonna have people that are gonna wrap their arms around you. They are going to take care of every
mm,
aspect of you and your family, hopefully. But primary care should be at the core of the delivery system. I think and people talk about, "Oh, there aren't enough primary care physicians out there." I think we really deeply need to understand whether there are primary care physicians out there, and there are new
right.
modalities. I mean, there's virtual primary care for sure. So, we know it's fundamental. We know that there's a lot of myths out there about how many there are, who they are. I also
Mhm.
think that primary care physicians need the support of colleagues. I think those that can sit and sit on a platform where there are colleagues, whether that's in their office, whether that's virtual, that can help them with diagnoses, help them being efficient. I think I think you mentioned that I'm working in private equity today. Some of the most interesting things out there are tools that make primary care physicians more efficient and their diagnoses higher quality. I think that's extremely important. And PCPs or whatever you want to call them, they need to get paid. And,
Yep.
there's a lot of controversy, and I don't even want to think I could possibly go understand the nuance of how primaries are paid. But, they don't get paid enough in some cases,
Right.
and they do need to get paid. So, I don't know if that, I mean, this is like such a short answer. I mean, you're doing some of the more interesting things in getting primary cares that want to still be somewhat independent. So important in our communities, those single shingle docs that are out there that you're seeing. I see one today. And
Yeah.
yeah, she is part of a larger group, but she is a sole practitioner. And we
So
need to
great.
be able to support them, make them available to our employees. I don't know, were there some specific aspects that you're especially interested in around making primary care more, I don't know, available, I guess, and more supported in our delivery system?
I'm I go back and forth between do we try to direct contract at and where it's simpler, like at a it's not simpler, but you have fewer counterparties if you're direct contracting with a big hospital system versus with direct primary care, advanced primary care, and embedding with primary care, way more counterparties. But I think the influence can be much more profound. I think that if we can align with primary care, we we are sowing the seeds to be able to change and realign the incentives for the whole industry. If primary care is
Absolutely.
partnered with us and aligned with us, then their referrals can align to value. And once patients go to value, now you have to offer value to earn more patients. Now you start changing the way the system has to work.
You nailed it. And I think this is what hopefully benefit folks that are listening to this podcast understand, that having primary care as the core value will ultimately fix the system,
Yeah.
and that this is a good thing, that you should potentially direct contract with a primary care group, or potentially work with somebody like HTA or some of the others that are out there, where you can contract for an entire platform of physicians. And I think you made a good point. Physicians are not business people. I mean, this is where we go back again. Make it easy for them to be contracted with you, to be paid enough to get the volume they need if you're actually going to ask them to take some risk. And,
Right.
that is the key to really improving the delivery system. So I
That's
just think it's God's work.
it's a perfect place to finish up. Thank you, Barb Wachsman, for joining us today on Broken Benefits.
Uh,
If someone needs to reach out to you or wants to learn more, encourage them to reach out on LinkedIn, I presume.
Absolutely. Although my LinkedIn is pretty awful and will be
Oh,
improved shortly. It's under construction. Let's put it that way. But definitely, I think Waxman, barb.waxman at FrazierPartners.com is also a good way to reach.
FrazierPartners.com. Perfect. Thanks for sharing that. Uh, Everyone, appreciate you for joining us today on Broken Benefits. If you like this, please subscribe and send it to a colleague who might enjoy this as well. And we'll see you next time. Thanks. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible.